Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Digoxin is not indicated in. Digoxin is indicated in atrial flutter, atrial fibrillation, and paroxysmal supraventricular tachycardia. It is not indicated in high output failure. Digoxin action is not affected by. Digoxin action is affected by electrolyte disturbances, renal failure, and HMI. It is not affected by hepatic disease. BNP is degraded by neutral endopeptidase degrades brain natriuretic peptide. Drugs used in congestive heart failure are nesiritide, digoxin, spironolactone, and losartan are used. Digoxin toxicity is aggravated by hypokalemia and hypercalcemia. Arteriolar dilators used in the treatment of congestive heart failure are hydralazine, nifedipine, prazosin, and enalapril are used in the treatment of congestive heart failure.
thank you and thank you for watching.